Hello and welcome to Nourish. My name is Kasha and I'm a health and wellness entrepreneur and student of Taoism and Chinese medicine. On this podcast, I share the stories and tools from Type A high achievers who have discovered that elusive state of balance between success and fostering connection, purpose, and inner awareness. Think yin and yang in flow. Now, I speak from experience when I share that I know firsthand how difficult it can be to integrate the two. I'm a Type A Capricorn who spent 11 years ruthlessly climbing the ladder of success in Silicon Valley. But for me, hustling without balance just led to burnout. We need to nourish ourselves proactively. I hope this podcast offers you inspiration on ways to do just that, so you can live the life of your dreams. Now let's jump into it. Hi everyone, welcome back to the Nourish podcast. I'm your host, Kasha, and I'm so overjoyed to be welcoming my next guest, Dr. Sydne Malawer. Dr. Sydne Malawer runs a private practice in Berkeley, California that specializes in the treatment of chronic complex conditions, in particular autoimmune dermatology, digestive issues, and joint pain. Now, Sydne is actually my personal acupuncturist, somebody who I've been seeing for the past few months with treatment of my chronic eczema, which has flared up over the past 6 months, or I guess 6 months ago, it flared pretty badly. And she's just been an absolute godsend in treating this condition. Sydne herself actually came to East Asian medicine through her own struggle with psoriasis. So she has a very personal investment in this whole process, and her style of practice is super unique. She practices what's called Japanese meridian therapy as per the teachings of Ikeda Masakazu under the guidance of her mentor, Dr. Barbara Martello. And this method is just so unique in treating a lot of these chronic conditions. And we really dive into it on today's episode. We talk about autoimmune dermatology. We talk about the treatment of autoimmune conditions in general, including some of the different conditions that Sydne sees on a daily basis or weekly basis. And then we dive really deep into eczema, understanding the root of eczema, understanding why it flares, what the treatment patterns and life cycle typically looks like, and so much more. Sydne holds a Bachelor of Science from Cornell University, graduated summa cum laude from the master's program in East Asian Medicine at the Acupuncture and Integrative Medicine College in Berkeley, and she also earned her doctorate from the same college, and she is a guest lecturer at AIMC Berkeley now and volunteers at the Charlotte Maxwell Integrative Cancer Care Center, providing acupuncture to low-income women with cancer. She does a lot, and I'm so glad that she made the time to join us on the podcast today. And without further ado, let's welcome Sydne Malawer to the podcast. Dr. Sydne Malawer, welcome to the Nourish podcast.
Thanks, Kasha. It's great to be here.
I'm so excited to see you in this setting, face to face. I feel like over the past several months, we've really bonded, considering that I've seen you once a week through some of my most difficult health and personal times, quite frankly. And so I'm so grateful to have you here, and also so grateful to have you sharing your knowledge and wisdom with me, but also with this community. So thank you.
Of course.
All right, we have a lot to get into. You know, we're going to be talking about my favorite topic. It's a love-hate relationship with my eczema and eczema in general, because I'm so pumped to really analyze it from the Chinese medicine point of view. But I want to start with a question that I ask every guest. And that is, what are 3 words that you would use to describe yourself?
So yeah, I have been thinking about that because sometimes it's hard because I feel like it changes. But the first one is probably deep curiosity. The biggest thing for me when dealing with anything is I want to understand it and I want to get to the truth. Sometimes that's impossible. And sometimes the pursuit of the truth is more meaningful than the truth itself. So that's definitely a big one for me. Empath is probably a big one. And not just in the, I feel for people and I want to help them. Like, honestly, those boundaries for me sometimes can get very blurred. And I don't know what I'm feeling and what the other person's feeling because they get mixed. So that's been both a blessing and a challenge in my life just feeling other people's feelings, because sometimes I just really don't want to, but I feel them anyway. And then the last one is integrity. So I say integrity, not that I always have integrity, but I always strive for it, because at the end of the day, sometimes saying the truth and being honest is way more difficult than telling a white lie. And the white lie seems harmless, but at the end of the day, I really try and choose integrity. I don't always make it, but that's definitely one of the things I really try to strive for.
Those words seem so accurate from my perspective, your patient. And, I love that you included those, because I'm like, oh, yes, of course. I feel that every single week when I see you. And I'll be very raw and real and share that when I first started seeing you, I was going through some flares of eczema and things were improving. Then I stopped seeing you and I came back to you with probably the worst situation that I've had in like 8 years, and the empathy that you've shown me, and like your level of like integrity to be kind of raw and real about, kind of what I should expect and how this healing journey will look, and what you know and what you don't know. And then coupling that with just how passionately you've been helping me and how much I have improved over the past just really weeks, honestly, at this point. For anybody out there who's dealing with severe eczema or a severe autoimmune condition of any kind, or really any disease of any kind that is kind of chronic like this, I cannot stress enough like how valuable that has been on like a personal level to have that support. So thank you.
No, of course.
So let's dive into that, because I know I'm not the only person that you support, even though I feel that way when I'm in the room for like an hour. And one of the things that you primarily focus on as a practitioner, and correct me if I'm describing this incorrectly, but really you focus on complex health issues such as autoimmune conditions. So can you share with us some of the conditions that you treat? We know eczema is one of them. So
Yeah. No, of course. And the reason why I say complex, I used to say like chronic autoimmune conditions, but sometimes they're not chronic. Sometimes they just come on fast and you don't know why. And so complex is the best way to describe it. So eczema is obviously one of them. Psoriasis is another. Dermatology in general is something that I get a lot of in the clinic, because honestly, Western medicine, while is great for some people, tends to miss the mark a lot when it comes to long-term management of these chronic skin conditions. So that's one. Not that it's wrong, just it doesn't always take into account the whole person. It's just talking about like, let's focus on this. And that's what Western medicine is very good at. It's like you have a problem. They're like, this is going to fix this problem specifically, not realizing that there's other problems possibly underneath. So that's one. Another one. So I'll just go over. It's hard because I treat a lot of different conditions, but I'll go over like what came into clinic this week, or the humans that came into clinic and their conditions, right? So Graves' disease is something that I have a good amount of in my clinic. I also have hypothyroidism. For those who don't know what Graves' disease is, it's a immune hyperthyroidism, meaning your body is producing way too much thyroid hormone, which effectively means your metabolism is going haywire, which creates a lot of issues around especially heart health and cardiac health. That's the first thing that Western medicine will try and mitigate. And I wholeheartedly agree. Anyone who has hyperthyroidism needs to go and talk to their doctor and possibly get on methimazole ASAP. But that's a whole other podcast. So I also have hypothyroidism coming in. Some of it is autoimmune, some of it's not. I've had tinnitus, which is like chronic ringing in the ears, which is very difficult to treat. But we made progress this week, which was awesome. Hot flashes is something that comes in a lot. A lot of people who have been on hormone replacement therapy for a long time, and when they start coming off of it, the hot flashes just go wild, and there's really no other effective treatments from a Western perspective except for hormone replacement therapy. So that comes through the clinic. So a lot of different conditions, particularly there's a lot of digestive stuff too. People who have Crohn's disease. I have a Crohn's disease patient. He's a teenager, so that's an interesting one. Also, there's a lot of like IBS, which I think some of them, I do a lot of lab testing in my practice, and some of the IBS I think has a deeper meaning. One of them, actually, we caught that she might have hypothyroidism, possibly Hashimoto's, that is contributing to the IBS. Yeah, and then some people come in for things like frozen shoulder that just hasn't responded to any other type of treatment. So that's kind of what I mean by complex. There are things that I tend to get people who have tried a lot of other things that haven't really worked, and then they come to me like last ditch effort. And sometimes they make great progress, and sometimes they don't. And I'm very, again, the whole integrity piece, I'm very honest about tracking progress and talking to people when I don't think enough progress is being made, and then we will troubleshoot from there.
Wow, it's really just conditions that are all over the map. Just to kind of ground it for people, autoimmune conditions. Now, the root of every autoimmune condition is different, but from a Western point of view, I know that there's like a broad definition, right? Can you share with our audience exactly what that is?
Yes. So autoimmune conditions from a Western perspective is when your immune system creates antibodies against your own tissue. So usually the autoimmune condition that you're diagnosed with tends to be due to the antibodies that you have produced in your body. And so they do a lot of different antibodies testing. So you have rheumatoid factor if you have like rheumatoid arthritis, or polymyalgia rheumatica, which is something that comes through my clinic sometimes and responds very, very well to diet change and acupuncture, along with herbal medicine. But honestly, it's the diet change that makes a huge difference for those ones. And then, for example, there's like for Graves' disease, you usually have antibodies to TPO, which is a enzyme that is used to create thyroid hormone in the thyroid. And you might have TPO, you might have thyroglobulin, which is a protein. You might have TSH receptor antibodies, a lot of times thyroid stimulating immunoglobulin, right? And so they test for these specific antibodies. The issue with autoimmune disease in this country, specifically in the United States, I'm not totally sure about everywhere else, is that it takes on average 5 years to get a diagnosis, which is wild. And a lot of people are unfortunately gaslit by their practitioners, and not like, again, practitioners, especially healthcare practitioners in this country right now, are so overburdened. So I'm not saying they necessarily mean to gaslight them, but a lot of times they're like, all your other tests are normal, so we're not going to go any further with testing. So like either this is in your head or you just have to deal. And I say on average 5 years. So there are people that go undiagnosed for years, up to decades, with autoimmune conditions, and they just feel like crap all the time. And that's what really is awful, is that Western medicine is fantastic. It is a great medicine. I have nothing against Western medicine. But with the system as it stands, intervention doesn't happen until serious disease has happened. And that is one of the issues with autoimmune diseases. By the time you have serious disease, your immune system could have destroyed like an entire kidney. It could have destroyed your thyroid. And I'm not trying to make people scared. That's not what this is. The beautiful thing is that there actually are other options outside of traditional Western care. Now, I do not agree that you should not get Western care, because a lot of times you'll need medication and this other type of care like functional nutritional therapy and East Asian medicine, specifically acupuncture and herbal medicines, especially herbal medicine, will be very, very helpful for that. So that's just my understanding of autoimmune and why I feel so passionate about working with people with autoimmune, because a lot of times they are at their wit's end and they don't know what else to do.
100%. I can so relate to that feeling. So from a Chinese medicine point of view, is there here we have this category of autoimmune conditions and all these different conditions fall under that umbrella. How does Chinese medicine view that? And what I'm really curious about, because we've introduced on other podcast episodes, like different kinds of patterns, right? And it's interesting because I'm like, could somebody have, let's say, a similar pattern to mine? I have eczema, right? But have like a completely different Western diagnosis. So like, is there an umbrella under Chinese medicine for something like autoimmune? How is it viewed from your perspective?
So that's interesting. And that's very much up for debate. And for my doctoral research, I focused a lot on one concept that can explain autoimmune conditions, which is called yin fire. So there are other concepts. So this is with Li Dongyuan. Li Dongyuan wrote the Pi Wei Lun, which is a medical text that is really quite fantastic and really ahead of its time. Like Li Dongyuan was not necessarily accepted during his time by other practitioners, but his work has stood the test of time. So Li Dongyuan was one of the first practitioners to introduce this idea of endogenous disease. So endogenous is like it starts from within. Up until then, most of Chinese...
And is that yin fire, essentially?
Yin fire. We'll talk about it.
Okay.
Right? Yin fire is like one concept, which I will explain. But let's just give the whole context of like how Chinese medicine came to be. And so before Li Dongyuan had introduced this concept of endogenous disease, aka disease that starts from the interior, from diet and lifestyle, the focus of Chinese medicine was really on exterior invasion, so exogenous disease. So like viruses and bacteria, and I mean, they didn't name it viruses and bacteria, right? They have different concepts and different pathogenic factors that they talk about. But they had really focused on that exterior invasion that could stay in the body for a very, very long time, right? So, and could lead to these like chronic issues over time, which still holds true today. A lot of people will talk about autoimmune disease has started as, you had a fever and you took a fever reducer and that trapped the pathogen inside. And so your body's still fighting a pathogen, whether it's there or not. So that's one concept of autoimmune disease. But the interesting thing about Li Dongyuan and this endogenous disease is he was really focused on this is disease that didn't have an exterior pathogen first, but it's really just developing from within from injudicious diet and improper lifestyle habits. Like especially they really focused on too much sex, which I thought was very interesting.
Whoa.
That is a huge part of it. Yeah. Granted, when we talk about male bodies and female bodies in terms of exhaustion with sex, that's another podcast, right? It's actually very different because the way orgasm work for male bodies is a little different than how it works for female bodies. And female bodies actually do not lose resources when they orgasm, while male bodies do. But it was obviously very, very focused on male bodies at the time. So they really focused on like too much sex is one of the lifestyle factors that could contribute to this. But so Li Dongyuan really focused on this endogenous disease. And he didn't ignore exogenous, but he really focused on endogenous disease. And the concept of yin fire comes from the displacement of ministerial fire by having a weak digestion. And that is something that you see. So backtrack, ministerial fire, let's just say ministerial fire is effectively the physiological, metabolic, thermodynamic fire in your body. Zeev Rosenberg, who is an incredible contributor to the English language field of Chinese medicine, he just published an incredible book called Afterglow that really focuses on ministerial fire because he sees it a lot as long COVID as a displacement of ministerial fire as well. But that's, again, another podcast. There's a lot of different podcasts that can come out of that.
Just writing it all down, okay?
Yeah, for sure. So with yin fire, so effectively what happens is weak digestion creates it so that the thermodynamic fire that is used for metabolism is misplaced and is still in the body wreaking havoc. So the way that you can think about it is it's like the pilot light in your stove. And if you are, cooking delicious oily bone broth and that comes out over the pot and sinks into the pilot light, what happens when grease gets in the pilot light? Explosion, right? And so that is the way you can view yin fire scenarios, is that the digestion is weak and it's allowing for this oily substance to, oil is used to cook. So that oil, instead of being in the pan, is going into the pilot light and wreaking havoc on the system.
That is Such a good analogy, by the way, especially, as somebody who I think is experiencing some of this, right?
Mm-hmm.
Like the heat, but also the cold at the same time, which is so strange. Can you talk a little bit about like the unique qualities of yin fire? Because I think, for people who don't fully understand like yin versus yang, like what are the qualities typically of yin versus yang? And then what does it look like when you have yin fire, which is kind of like a unique, in a way, weirdly discombobulated scenario?
So, yin fire in itself is not pathological. It's when you have yin fire scenarios. So, the way you can think of yang fire, it's a wood burning fire. And the way you think of yin fire, it's an oil burning fire. So, like, fossil fuels, gasoline, oil of any sort, right? And so, with yang fire, it's wood burning, right? And you need to keep on giving it wood and then
stoking the fire.
Yeah, exactly. Versus with yin fire, it's more of this like oily fossil fuel. And that's from Zev Rosenberg. Again, his book is fantastic if you're a practitioner and you're interested in working with yin fire scenarios. Highly recommend his book, as well as Sharon Weizenbaum has a course and healthy seminars on Li Dong Yuan. Absolutely fantastic. Highly recommend.
I'll link it all.
Yes. So the yin fire is more of this oil burning fire. And so they burn differently. They have different fuels, but they're both super necessary for like the world to go round. It's the same for the body, right? You have your yang fire, which is like, how do I describe yang fire in the body? Yang fire, they like to describe as more of this ethereal fire. So like that passion, that emotional fire, versus yin fire is more of the metabolic fire. So yin fire is more physical than yang fire.
So at which point is yin fire pathological? And like, how does it show up, right? Like, how does it translate to maybe symptoms? I'd love to talk about that.
Yes. So yin fire scenarios is when it becomes pathological. And yin fire scenarios are really multiple patterns mixed into one. So for example, with eczema, you usually have blood stasis and dampness. You like almost always have dampness with eczema. I think that you do, Mazen Al-Khafaji, who's the TCM dermatology expert like in the world right now, he talks about how there's always an element of dampness in fire, in eczema. So you have blood stasis with dampness and heat, and you could possibly have qi deficiency, which is like digestive deficiency. You have all of those mixed into one. And so your symptoms will be multiple. So when I think of yin fire scenarios, because actually for my doctoral research, I created a course for practitioners on yin fire. And what I talked about is how to identify yin fire in the clinic. And one of the ways—
How to identify yin fire or yin fire scenarios?
Yin fire scenarios.
Okay, cool.
Thank you for the clarification. So how to identify yin fire scenarios in clinic. And one of the big differences you'll see, or one of the ways you can think about yin fire scenarios is when your patient has a completely different tongue and pulse, right? So they seem to have these opposite things happening where their pulse might feel frail and slow and their tongue is bright red and fiery, because those are two diagnostics that are extremely important in East Asian medicine. So that's one way. Another way is a lot of people, we talked about this, with yin fire scenarios tend to have cold hands and feet, but they have a lot of rampant heat going on in the body. So that's also a big one. They tend to be the people that leave you scratching your head. You're like, you have all these different symptoms that don't seem to match up. And it's probably because you have all the things all at once, right? And so when you treat yin fire scenarios, you have to actually kind of pull all of this. It's like a knot. So Bob Flaws talks about knotty diseases, like KNOTTY. And with knotty diseases, you have multiple patterns strung together, but tied together in a knot. And the only way to undo a knot is to pull each string very strategically at specific times so that you loosen the knot overall. And that's how you treat a yin fire scenario, instead of just like clear heat, clear dampness, move blood for blood stasis. You have to delicately untie all of it little by little.
Ugh. And that's what makes it so complicated, right? Because you have somebody who's like both inflamed and cold at the same time, or like hot on top, cold on bottom, speaking for myself in some cases. Yeah. Or feeling like fatigued, but then also having like crazy bursts of energy, let's say, like these like opposite kinds of scenarios all in one.
Yeah. Fatigue with insomnia.
Oh, yes. Thank you. Thank you for describing me to a T right here. So I know we can talk about all the different kind of scenarios and how they translate to, kind of, or how they map to certain types of diseases. But let's talk about eczema, and we can use me as a case study. So feel free to reference me and kind of the evolution of the disease that you've witnessed within my body. But first, let's start with like, what exactly is eczema? I mean, we could do like the Western definition for people and then translate it to the East Asian definition, knowing that there probably are multiple. So maybe we can talk about my scenario specifically, but I'll let you take it from here.
Yeah, of course. So from a Western perspective, eczema is when the barrier of your skin gets compromised. So what they find in people with eczema is that some have just eczema, but most people have more than one of the top 3 atopic issues, right? So there's something that happens in childhood that's called the atopic march, where Mazen Al-Kafaji talks about this in his course. His course, honestly, for anybody who is doing any sort of dermatology, like you have to take his course. There's literally no way around it. Because since taking his course, it's just, because I was treating eczema before it, but since taking it, it's like opened my eyes just so much more about what's going on underneath. Because this is somebody who has like over 40 years experience with these diseases, these dermatological diseases from an East Asian medicine perspective. And he only does herbs, which is fascinating. So I actually find that acupuncture and herbs makes it go away faster or like unflare faster. But he only does herbs because he's like, honestly, that's what's worth my time because that's what's going to make a difference.
That's crazy. I will go back to my question in a second, but I just want to call out, I find that to be so fascinating because I've had, and I told you this, that I'm taking herbs. At this point, I'm taking raw herbs, which have been really effective. But when I come in to see you, it's like a rewiring of my body's nervous system, which actually helps me with my flares.
Yes, 100%.
So I find that so crazy that herbs could be enough in like other scenarios. But anyway, side tangent. We could talk about why in a separate question, but just to kind of get back to the roots. So from a Western point of view, it's a compromised skin barrier that ends up
due to hypersensitivity to the environment. So that's why there's in childhood, there's something.
So wait, is it always environmental, by the way, or is it a compromised barrier that, coupled with stress leads to you're reactive to your environment? Because I find that to be so interesting. Like, is it always environmentally based?
So I would say yes and. So people who are considered atopic, so this is atopic eczema we're talking about. There's different types of eczema that aren't atopic in nature, but atopics tend to have one or more of the following, which is eczema, allergic rhinitis, aka allergies, and allergic asthma, right? And then there's a fourth one, which is food allergies, right? So people with atopic eczema tend to have at least 2, if not all of them, right? And what Mazen talks about is that if you have all of them, it's actually like more difficult to treat and they're going to have to be in treatment longer. But the reason why this happens is because your immune systems are wired so that they are Th2 cytokine dominant, meaning they react so much more to environmental allergens and don't react as well to like external pathogens like bacteria, which is why a lot of times with eczema, there are concurrent staph infections, right? Which you and I have talked about, right? So your body is like, thinks that every allergen is like a complete invader or like everything in the environment is a complete invader. And so it's like hyper sensitive. And then because it's so focused on these allergens, it's not focused on the bacteria and the viruses. So you get sick all the time, right? I have one of my eczema patients, she's a teacher. And so with little kids and gets sick all the time because of this Th2 cytokine dominance with this Th1 cytokine deficiency. So that's just from a Western perspective. So a lot of people with eczema will have allergic rhinitis, allergic asthma, and/or food allergies as well. So that's from Western. From the Eastern medicine side, again, Mazen Al-Khafaji, I'm going to, totally botch this, but his description, so in Chinese medicine, the big term for it is, I think it's Sifeng, which is for wind of the four crooks. So it has been around for millennia, right? It has been treated with Chinese medicine for millennia. So obviously it's been here for a long time. And so from that perspective, it's when your body tends to generate dampness along with heat and eventual blood stasis. That's kind of the things that most of them have in common. And the heat is usually in the blood. So blood stasis is kind of always there in long-term heat scenarios, because when heat dries up the blood, it doesn't move as well. So it becomes static. And so from a Chinese medical standpoint, you always need to be looking at the degree of dampness, the degree of heat, and the degree of blood stasis when you're treating atopic eczema specifically.
So what about the presence of or the influence of emotional factors, right? Because, for example, and we've talked about this at great length, but my eczema is like strangely positioned on my pericardium channel, right? Like, what is going on there? How do emotions influence that, and what are your thoughts on, how that would kind of translate back to some of the general patterns around eczema?
Yes.
Right? Like, is it just heat in the like what's going on there?
Yeah. So emotions, strong emotions, pathologically strong emotions, stagnate the blood and generate heat, specifically in the heart, because all emotions lead to the heart. And so the pericardium's job is to take heat away from the heart and put it down into the kidneys to store, right? And that's actually becomes the ministerial fire, and that actually becomes the yin fire. So what happens is, when you have too much heat in the heart, the pericardium, so the heart has like fail safes, right? Because you don't want to overheat the heart. And so its fail safes are the lungs, which is attached to the skin, by the way. It's connected with the skin. So it's through the lungs, through the pericardium, and through the kidney. Those are the three fail safes. So kidney has water to balance out the fire. Pericardium takes the fire down to the kidney to be stored. And then the lungs move qi in the chest to get heat away from the heart. So if you have way too much heat in the heart, all those fail-safes are going to be working extra, right? And so one of the formulas that's usually a baby formula within a larger eczema formula is Daucherson, which is translated to clear the red powder, which is clear the heart. And so when you clear the heart, you clear heat from the heart, you're clearing heat from the blood, because all of the blood goes through the heart. So when you're having strong emotions, you're allowing all this heat to build up in the heart. And so then all the fail-safes are trying to get it out of the heart. And that's why it can show up on your skin, right? And for some people, it shows up with high blood pressure. With other people, it shows up with like high blood pressure due to like kidney issues, right? So strong, you just happen to be like of the camp where it goes through the lungs, aka via the skin. And so that's how heart heat manifests in your body. And that's your body trying to get rid of that heart heat, is the eczema flare.
Well, thank you, body, for putting me in that camp. By the way, that really resonates deeply as well. My dad, slightly related tangent here, he has high blood pressure. And it's like interesting because he's definitely like one of those like heated guys, not so much now in like his older age. Sorry, Dad, you're not old. You're just in your later stage of life. Like it would like definitely show up, and like it would come out with like outbursts sometimes when you're younger and things like that. So it's just interesting that you kind of shared the examples of how it can pop up in different ways. So I want to zoom in for a moment on this like notion of like heat in the heart and like the emotional kind of influence that that has. Because I know that a lot, or I guess how emotional influences can have an effect on the heat that is resulting in the heart, perhaps is a better way of saying it. Because I know that it's a very heated, no pun intended, time like in the world. Like a lot of the things that are going on can be really triggering for people, myself included. And I'm curious, as we think about the way that lifestyle influences these types of things, what are some of the things that we can be doing proactively to clear heart heat or to really like release things like emotions that could potentially cause some of that heat?
So that is a great question. So one of the things I really think about, and I always advise my patients on when there is strong heat due to stress, because for a lot of people, it's the stress component. I always tell them that the antidote to stress is not relaxation, it's joy. And so one of the things that you can do, and overjoy is actually a pathological emotion of the heart, which you and I have talked about too, because those times you come in super excited and your eczema's flared is because you're, instead of it being anger or this frustration, it's an overjoy. But joy, not overjoy, but joy is the antidote to stress because it takes you out of a stress spiral and brings you into more of a resolution spiral, or out like not even spiral. Laurel Mellon, she is a PhD out of UCSF. She wrote a book called Wired for Joy. Highly, highly recommend it as a person, patient, practitioner, human, because I love scientific explanations for things. That just really reiterated to me that when you're feeling all of this stress, the best thing you can do is experience joy. And sometimes that's why gratitude journals work for a lot of people, because that's a way that they can experience joy. And I'm not talking about like go out and party. I'm talking about like have a conversation with your best friend. Just chat. Go for a walk with your pooch, right? Play with your cat. If you have eczema, you likely don't have a cat because you're probably allergic to it. But there are people that do, right? Write a letter to your childhood best friend, just to write it, right? You go to the movies and get a thing of popcorn and just watch a movie. That can be, I don't know, for me, that brings me a lot of joy because that's what we would do when we were kids, right? That nostalgia. So from what you can do at home, really, when you're feeling stressed, don't think about relaxation, right? Don't just sit on the couch and just doom scroll, right? That's not helpful.
Watch the Kardashians if that brings you joy.
I mean, if that brings you joy, go for it. Who am I to judge, right? But definitely do something for joy. Now, in terms of Chinese medical theory, there are Qigong moves that are really, really helpful for getting heat out of the heart. So I would just literally go to YouTube and put in Qigong for heart. That's a big one, right? Another thing to note is that the heart is related with the small intestines in Chinese medicine, which is why there's a lot of food relationships with eczema and the skin in general. That's why there's such a strong connection, because the small intestine is still the outside of the body, right? What the small intestine does is it discerns what it's going to let into the body and what's going to go to the large intestine to then be expelled, right? So because of its relationship to the heart, eating nourishing foods will help to reduce stress. Like no ice cream, no sugar. I'm talking about like porridge and congee and like delicious soups and just these very nourishing foods that don't have any of your trigger foods in it is very, very helpful in terms of like allowing the small intestines to do its job well so that it can then take heat away from the heart. Oh, because that's one of the other fail safes that I forgot to mention. Small intestines. Forgot that. But small intestine is also a way to get heat out of the heart.
Amazing. So I want to shift gears for a moment and speaking specifically about eczema, because I hope that all the folks in my community who have eczema, who are listening to this, can hopefully find some hope in your description or answer to the next question. But you and I have talked about at length how the healing journey for eczema patients is very rarely, if ever, linear. Can you talk a bit about what that like healing journey typically looks like?
Yes, for sure. So eczema is very different from psoriasis in how it behaves as it's getting better. Eczema clears much faster than psoriasis, but can come back much more easily. While psoriasis, you like have slow and steady clearing, and then eventually the lesions go away. And then if you can fortify that treatment by like nourishing the blood, nourishing the chi, and nourishing the body fluids and keeping heat at bay, you're likely not going to have another flare for a while, if ever. Some people claim that never. I don't know. As a psoriatic myself, I can promise you, like, I can go for years without a flare, but I eventually flare again. And granted, it's only been 36 years, so we'll see what the next 10 years look like. But for atopics, specifically with eczema, that it's not that slow, slow decline and then fortified. You're always kind of going to be like in and out. So the great thing is that once it starts clearing, it clears, right? And you've experienced this, right? Where like in 1 week, it went down by 80%, which is fantastic. And you will very rarely get that with psoriasis, just so you know. But you are more vulnerable to it coming back. And during the treatment process, you'll have little flares, right? And then we just, nip them in the bud, figure it out from there. And it's always going to be a moving target. But eventually, when you get to a point where your skin is completely clear, you really want to focus on fortifying the immune system so that like keeping that Th2 dominance down and raising that Th1 deficiency so that your immune system's doing things properly instead of overreacting. And so that's the big thing with people with eczema that they need to pay attention to, is that don't get overwhelmed when it gets a little bit worse after it's gotten better, right? It's going to be a step-by-step process, but it's going to go up and down a lot quicker than it is for other skin diseases. So that does not mean that you've lost all hope. It doesn't mean you're always going to have eczema your whole life. That's not what it means at all. The fact that your immune system can get better, like your immune system can calm down enough that you don't have a flare for a while, means your body can correct itself. And that's beautiful. And then you just know when you are flaring, there's something going on, whether emotionally, environmentally, spiritually, if you want to go down that route, right? Just know that it is your body's alarm system, right? And then you go from there. And then you go to your practitioner, you go to the things that you know have worked for you in the past, and eventually it will calm down.
I think that's a really powerful reframe, to just recognize that it's your body's alarm system and it's just trying to help you pay attention to what's going on inside. Because as you have seen so many times, especially for people who suffer from severe eczema, and it can be completely debilitating, right? Like there were a couple of weeks in there, probably about a month, where I was not sleeping through the night. I was just waking up in the middle of the night, flaring, and it was so rough. And I was like coming in tears to you for like, help me. And there's just like this sense of helplessness and desperation that, as somebody who has suffered from, other acute conditions, like let's say breaking an ankle and going through surgery, or, other diseases, like there's just this like almost like lack of predictability that can make it so difficult. And so I'm really glad that you were able to describe what that path looks like. And I think that'll be really supportive for people, and also to reframe what's actually happening in the body.
But that's helpful for all autoimmune conditions too, is you recognize that it's, there's going to be times of flare and there's going to be times of remission, right? And you just pay attention to when that happens. And I'm not saying it doesn't suck. Like when your alarm goes off in the morning, you are totally pissed because you don't want to get up. So when your body alarm goes off with the eczema, like it's okay to be really pissed and really upset. And like, why is this happening again? Right? Let that emotion happen, but just know that while there is no predictability, there are no guarantees. And that's what I told you, Kasha, when we were starting with the raw herbs, because the raw herbal formula is much more expensive than what we had been doing, but it's for a short period of time, right? And and you saw the results, right? Because at the end of the day, I love liquid concentrates. I think they're fantastic and they really, really help. But when you're going through a crazy flare, like your body can't assimilate anything except for that raw. And then also Mazen Alkafaji really just focuses on raw, because he's like, nothing compares to raw. And it's true. And I would put everybody on raw if I thought that everyone would comply. but I'd rather people do 100% or 90% of something that's 80% effective than 0% of something that's 100% effective. But when you're at a desperate state that you don't care. You're like, just do it. I want to make it happen. And that's something too for eczema as well. There is no magic bullet. And I just want you to remember that. Like, there is no magic bullet when it comes to treating your eczema. That's why we do internal medicine as well as external. As a practitioner, what Mazen has told us is that if you're batting at 70%, I don't know what that actually is in baseball, but if you're never going to bat 1,000, right? So I guess if you're batting 700, you're doing really, really well. And unfortunately, there are cases, especially those with long-term steroid use, that are really, really hard to get rid of because the integrity of the skin has been compromised with very long-term steroid use. Now, I'm not saying that you're not going to get benefit and it's not worth like seeking treatment for it, but just know there is no magic bullet and there is no guarantee. The only thing you want to look for is a practitioner who's willing to listen, who knows enough to know where to find answers if they don't know them, and who is willing to like touch and go with you, right? Because that's what it is. Like at the end of the day, you need a support system when you're going through any sort of autoimmune flare, but especially eczema, because it is debilitating. Because at least with psoriasis, sometimes it doesn't itch. It hurts and burns, but it doesn't itch. Like, it is maddening because eczema always itches. It always itches. And that is debilitating, right? So it sucks. Totally understand. And I don't blame you for being like, when anyone with eczema is going through a flare, I don't blame you for being like upset and frustrated and angry and overwhelmed, and you don't know where there's an end in sight. But just know everyone is different and everyone's timetable is different. You just want to find a team that's willing to work with you to get you to at least feeling better. And that's what you want. That's why acupuncture for me is just as important as herbs when it comes to these skin and autoimmune conditions, because having that weekly or biweekly checkpoint with someone who cares can make all the difference.
Plus the effects of just like, I'm sure it's doing something for my skin, but like just the like nervous system effects that I get from coming to see you. I mean, I love my therapist. Shout out Lori. She's been on the podcast. I adore her. And of course I feel better, but my nervous system is like so heightened, especially and I'll decide at time of publishing if I'm going to include some of like my recent pictures because they look much better now, but like just for people to even understand like the level of suffering that people can go through with this, like it just completely overrides like everything else. It's just like your number one focus while you're trying to like live and hang out with people and work and do whatever it is you're doing. Like, so thank you for being my support system, Sydne, like one of many, but such a pivotal part of my support system, and your empathy, your curiosity, your integrity, and so much more. Like, it is just showing through. So I just want to shout that out right there.
No, of course. It's my honor. This is what I want to do with my life. This is what I want to be when I grow up. So it's really
You're being it.
Comforting to hear that. Yeah.
You're being it. You're just living it. So there you go. I could chat with you for hours, but we are coming up on time. So I'm going to have a lot of hyperlinking to do. I have to go through this entire interview and like grab all the books and the resources, but I want to make sure that I give you a chance to also share where can people find you. Do you have any news you want to share with the audience around what you have coming up? And everything will be hyperlinked, of course. So let us know, because I have a feeling some folks will want to reach out.
No, of course. So you can reach me through my website. So it's www.sydnemallory.com, which Kasha will provide. Though I am changing the name of my clinic sometime in the next 6 months because it's going beyond me. I actually am hiring another practitioner, possibly two. Well, I'm in that process of figuring that out. But because I'm at the point where my schedule is super packed and it's hard for people to get in, and I hate when people have to wait for care. So I'm training people specifically in the style that I practice, which is Japanese meridian therapy via Ikeda Masakazu Sensei. And so that's exciting. That's exciting news. I'm expanding my practice to include other practitioners. Then I'm also in the next year going to be doing the continuing education class on Ian fire scenarios. So for practitioners, you can look out for that. But yeah, other than that, that's a lot going on. So that's my news.
That is a lot going on top of all the people that you help day to day. Sydne, I'm so glad we were able to get you on. Thank you so much for joining us. And thank you to all you listeners for tuning in. It was an absolute pleasure. Thank you so much for tuning into this episode of Nourish. If you enjoyed this conversation, please consider leaving a review or sharing it with a friend. Reviews really help this podcast grow and reach a larger audience, and I'm so grateful for that. I publish new episodes twice a month, so hit the subscribe button to be notified. See you next time.